Also on the local front, it's been well over 3 months since junior doctors walked out of their workplaces to protest the government's plan to expand the number of future doctors. With growing patient concerns, the administration is once again urging them to return to work, saying those who do so will face fewer penalties. Kun-woo has more.
On the 100th day since junior doctors left their workplaces in masse, the government reiterated its calls for them to return, noting some have already done so. At a briefing following a meeting of the Central Disaster and Safety Countermeasure headquarters on Wednesday, Second Vice Minister for Health and Welfare, Min-soo, also said doctors who return now will face fewer penalties.
Don't hesitate and return to your hospitals for your patients, your fellow medical staff, and also your future. The government will do its best to keep penalties on those who return at a minimum. There will be firm differences between those who return and those who do not.
Nearly 700 trainee doctors working at 100 major training hospitals were reported to be at their workplaces as of Tuesday, up by 122 compared to the month before. When looking at all 211 training hospitals nationwide, around 7% of the total number of trainee doctors were working. During the briefing, Vice Minister Park also thanked medical staff for carrying on with their duties, saying they helped prevent a medical disruption from occurring. The same day, however, an official from the Korean Society of Emergency Medicine shared the difficulties medical staff faced in running emergency rooms for 24 hours a day without the junior doctors. The official said the number of doctors available for work had shrunk by 1/3 recently, as those doctors also took care of ward shift duties, where it used to be a rotation of 2 to 3 people in a 24-hour period. Accordingly, the official said medical staff have been barely operating emergency rooms, adding that the KSEM cannot guarantee how long this can continue due to the heavy workload. Also on Wednesday, Prime Minister Han Duck-soo said a cabinet meeting the day before signed off an additional $56 million to be given to hospitals to bolster their emergency medical systems. That's on top of the $94 million already given to support recruitment, salaries, and running costs. The additional amount will be used to support extra pay and educational fees for nurses who have been a big help filling in for the doctors under the supervision of consultants. Kun-woo, Arirang News.